Hey, so thanks for talking to me about labiaplasty.
Of course.
You had a labiaplasty a few months ago.
Yes.
So I'm excited to hear how that's been for you. Maybe we can just start at the beginning and tell me how you came to make that decision and up until today.
Well, it started years ago. Obviously, once I went through puberty, things started looking a little differently down there. It became uncomfortable, but I was just thinking that that was normal.
Yeah.
So as I got older and I started doing a little bit more research, I realized that my inner labia was a lot larger than I was comfortable with. So I began, intercourse was painful.
Yeah.
Spin classes were painful.
Right.
And I just got bike riding, yes. And it just got to the point where I felt like I needed to do something about it.
Yeah, so how did you go about finding someone to do your surgery?
Google. I did a lot of Googling.
Yeah.
I looked at a lot of photos online of different surgeons here in the Houston area. What I saw aesthetically was not good. I didn't like what I was seeing. I gave up the search for a while because I didn't feel that anybody had the experience within the area to do it properly until I came across your website, and then I met you, and the rest was history.
Yeah, well, so tell me what was your experience with the first time we met and then going through the surgery process? How was that for you?
So obviously coming in and speaking to somebody about it is putting yourself in a vulnerable position because it is such a private topic. Besides my husband, I didn't discuss it with anybody. But coming into your office, you obviously made me feel extremely comfortable that having those feelings is okay, it's normal, and not to feel shamed about feeling that way about my own body.
Yeah, do you think a lot of women do feel ashamed about that?
Yes, absolutely.
Because we can't talk about it.
No, I mean, we're not going to go have happy hour with our girlfriends to talk about our labias, so.
Yeah, it's funny because, I mean, we do talk about almost everything with our girlfriends, but we just don't talk about that. And also with doctors. I don't think most people talk to their doctors about it.
No, they don't. Obviously, you don't want to feel that people are judging you, that you're uncomfortable with the way that your labia looks, because people will judge you. People can judge you. But it is normal to feel that way, and a lot of women do feel that way.
For sure.
And it's uncomfortable.
Yeah, that's an interesting comment, actually, because I've heard that before, that when people have presented it to their physician, that they've been sort of brushed off or judged in a way, like that's stupid, that's normal, why are you worried about that?
Right.
And then you'll go right back into your shell probably and not tell anybody else. So.
Right, and it's not just the aesthetic part of it. It gets uncomfortable during intercourse, or if you're during like spin classes, like we mentioned. So there are a whole host of problems that come with it as well.
Yeah,
aside from the aesthetic.
Yeah, and you can live with it. I remember we talked about it as there's a normal range, and if anyone is happy with the way she looks, there's no need to change it. But I remember us talking about that. I personally don't see any difference between that and having a tummy tuck or changing your breasts or
it's just extra skin. It's just in a different location.
Right. Yeah, it's funny. It gets a lot more attention, I guess, because it's in that location.
Yes.
It's more difficult to talk about, and
absolutely,
a lot of doctors kind of resist the idea. Right. So we had the consultation and discussed what you wanted. And then what was the surgery process like for you? How did you experience the surgery center and
it was very smooth, very easy to schedule everything, organized. I went in the morning of, filled out the paperwork, was rolled into the back, got my IV, and fell asleep, and then a second later it was done. So nice. It was I wouldn't call it easy, but it was very seamless.
And then how did it feel when you woke up?
Well, I think the anesthetic still hadn't worn off, so I was definitely okay. It wasn't painless, but I was able to manage the pain fairly easily with the medication.
Yeah, so the local anesthetic after the surgery, it really helps.
Yes, yes.
So what about the days after? How did you experience that? How long did it take you to feel okay?
About 3 days. When I started moving around day 2, about 3 days I was really able to get back into the swing of things. But it was about a week.
Yeah. So pretty quick, but there
Pretty
is a significant recovery.
Yes.
Yeah.
It's not something that you just come in and out of and
do it in the office and go back to work the next day.
No, you definitely need to take some time off, which is fine, watch some TV and relax.
Yeah, and get a chance to relax. Now, I know you're super active, you're really fit, you work out a lot. How long was it before you could get back into your full routine?
I think it was about 4 weeks. 4 weeks. I just sort of, I think at week 4, when you gave me the green light, I eased into it a little bit, and then waited a few weeks until I was in spin class and things like that. But I did a little bit of exercise at 4 weeks and then just gradually built up to it.
And so now I lost count. How many months?
I had it in April, I think.
Yeah. So we're more than 6 months now.
Yep.
What do you think? How do you feel?
I love it. I'm not as self-conscious with my husband anymore, which is nice. And no discomfort during intercourse or during any sitting long periods of time. It's great. I love it.
And you went to spin class today.
I did, yes. I did.
Awesome. So what would you tell someone who's maybe stuck in that place of being afraid to mention it or afraid to take that step forward to help herself feel better?
Find a physician that they are very experienced in this surgery, because I've seen a lot of surgeries that other plastic surgeons have done that aesthetically just look terrible.
Yeah.
So find a really experienced surgeon, and this is a safe zone. I felt very comfortable with you. I did not feel judged whatsoever. And if it's bothering you and it's something that you think about frequently and continue to think about, then at least get a consultation and take it from there.
Yeah, I think that's really good advice. I always tell people I don't want anyone to have surgery who doesn't want surgery, but
right.
We are in charge of our own bodies. So if there's some small thing that we can safely do that improves our self-confidence, I think.
Yes, why not?
Why not?
Right.